Welcome to this video on ECMO Basics. My name is Kesava Ramakrishnan. I'm a pediatric intensivist trained in United Kingdom. ECMO stands for extracorporeal membrane oxygenation. What this basically means is that the oxygenation is done outside the body. Blood is drawn using a pump from the patient, passed through a membrane lung where oxygen is added and carbon dioxide is removed and is pumped back into the patient. ECMO is the most advanced form of life support that we can provide our patients in critical care units. How can ECMO help the patient? First of all, ECMO can restore or improve oxygen delivery to end organs, which prevents irreversible injury to the organs. It can also take over the function of the lungs, which will enable us to limit damaging therapies such as high ventilator settings, which may be damaging the lungs. ECMO can also reduce myocardial oxygen demand and provide myocardial rest. It may also enable us to wean high vasopressor doses, thereby enabling a faster myocardial recovery. However, we have to realize that ECMO is very time-limited therapy that can buy a little bit more extra time for the patients to recover. ECMO can be provided in two different configurations. The first is veno-venous ECMO. As the name indicates, blood is drawn from one of the great veins in the body, passed through the membrane lung, and pumped back into the other great vein. This configuration of ECMO can take over the function of the lungs and is used for respiratory failure. The second configuration of ECMO is veno-arterial ECMO. As the name indicates, blood is drawn from one of the great veins or right atrium, passed through the membrane lung for oxygenation and removal of carbon dioxide, and is pumped back into aorta or one of its major branches. This configuration of ECMO can provide or take over the function of both the lungs and the heart. This configuration is used for patients in cardiogenic shock or in cardiac arrest when return of spontaneous circulation cannot be achieved by CPR.